Promising. It does repeal the individual and employer mandate. It puts Medicaid on a more sustainable path, inflation. It leaves pre-existing illnesses alone, so you'll never be denied coverage because you're sick. So that's a pretty good place to start.
Meaner. Can you read it? It cuts health care for those who need it most, just to give a tax break for those who need it least.
Only hours after Senate Republicans unveiled their bill to repeal Obamacare, and tonight it could already be in trouble. 4 Republican senators say they oppose the plan. We're talking Rand Paul of Kentucky, Ted Cruz of Texas, Ron Johnson of Wisconsin, and Mike Lee of Utah. So what's in this plan? Some of the things. This proposal cuts Medicaid gradually by creating annual limits on how much federal money goes into each state's program. It ends penalties for you for not buying health insurance and by slashing Obamacare. No number on how much this plan is going to cost. That should be out from the Congressional Budget Office sometime next week. But let's break this bill down right now. Our health panel tonight. Robert Grayboys, he's Senior Research Fellow and Healthcare Scholar at George Mason University. Leighton Koo, Professor and Director of the Center for Health Policy Research at George Washington University. Siraj Hashmi, he's Assistant Editor of Red Alert Politics. And Alex Bolton, writer at The Hill. Gentlemen, your take on this bill. Well, let's start right here. What do you think?
Well, this bill got a pretty chilly reception this morning when it was presented to the Senate Republican Conference. You have conservatives are upset. They feel, in particular, Rand Paul of Kentucky, who's against this bill, says it spends more than Obamacare does in subsidies over the first 2 years if you add in the stabilization fund to shore up the marketplaces. On the other side of the spectrum, moderates are upset about these cuts to Medicaid and how it's going to affect their constituents. So right now, not only are the Democrats unified in opposition to this bill, but Republicans are divided and they're short the votes to get it passed next week.
So, Raj, what's your take?
Well, first of all, many of the criticisms that Republicans made of Democrats when Obamacare was first drafted, those backroom deals where the doors are closed off, that same criticism can be made about Mitch McConnell and the Republicans who crafted this bill. It's rather unfortunate that, I mean, of course, it's Washington, and in politics we always see this type of hypocrisy. But the fact that there's hardly any change between the House bill and the Senate bill, I think really strikes conservatives dead, because they essentially, no pun intended, but essentially everything that they wanted to be in the Senate bill isn't really there.
Mr. Koo, why now? Why the rush? Or is there a rush to get it done before the 4th of July recess?
Well, the rush to do it because they think they have motivation. And again, having something occur before a break puts pressure in senators to try to hurry up and make compromises quickly. But, there are going to be a lot of losers, a lot of people losing health insurance. We think conceivably 1 million people losing jobs because of this. So there are a lot of losers in this bill.
Okay. Thoughts?
I tend to think that first of all, the House bill was actually a fairly modest step away from the ACA, and this one is a modest step away from the House bill. I don't, if it passes, if it doesn't, I don't think there's an enormous amount of difference. Yes, yeah, there will be some winners, some losers, both financially and in terms of health and insurance, but it's mostly redistributing things.
You think mostly losers?
Well, no, there are some winners. So if you're a relatively wealthy person, you're a big winner from the tax breaks. There may be some additional people who'll get health insurance because of the way the bill is designed, but in general, and we haven't seen the CBO score, I'd expect still very large numbers of people losing health insurance. We haven't completed our analysis of economic effects, but my guess is still deep hurt across the country.
The House bill they were predicting, what, 20+ million?
23 million.
Okay, and with this, you expect what? Even before we hear from the Congressional Budget Office?
Similar ballpark.
Somewhere in that ballpark.
Okay, which means what?
Well, I think, one, the individual and employer mandates kind of is basically the source for why there's going to be fewer people on health care or health insurance. I mean, fewer regulations is going to do that. Conservatives welcome that, but again, it's a huge departure from the original Republican and conservative message of repealing Obamacare first and then starting over to replace it. And this is basically, Rand Paul said the best is Obamacare light. That's essentially what it is, and there's hardly any change to it.
Right. So what do we do now? Okay. Well, number one, you got 4 Republicans who are opposed. They need 2 to bring 2 over. Do they get that before they leave for the recess?
I think there's a shot that they do. I mean, Ted Cruz said that he's open to negotiating, but some of the things he's asking for are non-starters. I mean, he's talking about allowing states to sell, allowing insurance companies to sell policies across state lines. I mean, that's something that's probably not going to go anywhere. Ron Johnson, on the other hand, he says that the problem with this bill is that basically it doesn't lower premiums, and it's hard to see how that can change.
Well, given that the House bill went even further, is this about as good as it gets? I mean, if they're determined to repeal Obamacare?
Well, they're trying to rush it, and that's the problem. With Obamacare, it took somewhere over a year, I think around 15 months, of actual negotiation. Republicans are so... they are anxious to pass something immediately to show the American people that they got something done, that they're doing it
But they also need the savings, though, right? I mean, to move on to the rest of the agenda, tax care, infrastructure.
Well, they wanted to do tax care. Paul Ryan said that he wanted to do tax reform, and this is a complete departure from it.
To be continued. Thank you, gentlemen. Coming up next,